If you receive CAR T-cell therapy as an inpatient at MD Anderson Cancer Center, the care team recommends having a caregiver stay with you in the hospital. This is so they can help watch for early symptoms of neurological toxicity and report changes to the nurse. Before the cell infusion, the care team will ask you to write a sentence and answer some questions that will help them assess your neurological status. The care team will repeat this process at least twice a day while you are in the hospital. About an hour before the cell infusion, the care team will give you some Benadryl and Tylenol to help prevent reactions to the cell preservative. Then, the cells are infused, which usually takes 30 minutes or less. The nurses will watch you closely during and after the cell infusion. Patients usually do not have side effects during or immediately after the cell infusion. You'll likely be sleepy from the Benadryl. Once the sleepiness wears off and your nurses feel it's safe for you to move around, they will encourage you to walk around the nursing unit. Within a few days after your cell infusion, you may experience side effects, including cytokine release syndrome and neurological toxicities. Cytokine release syndrome almost always begins with fever. The fever may be very high and occur along with chills and body aches. These symptoms can be treated with Tylenol, a cooling blanket, or ice packs. If the fever continues for several days, or if you develop other symptoms such as low blood pressure, shortness of breath, low oxygen levels in the blood, or other side effects, the care team may need to give you medicines to treat these symptoms. If you have low blood pressure that needs to be treated with certain medicines, or if you need high-flow oxygen, the care team may decide to transfer you to the intensive care unit so that you can be watched more closely. Your caregiver may stay with you in the intensive care unit. Also, after you receive the CAR T cells, you may develop neurological symptoms, such as headache, tremors, confusion, restlessness, seizures, not being able to speak or recognize your family, problems with moving your arms or legs, or swelling in the brain. A neurology doctor may come to assess your condition and may order a CAT scan or MRI of the brain and an EEG, which is a test that looks at electrical activity in the brain. To decrease the risk of seizures, the care team may start you on an anti-seizure medicine on the day of the cell infusion and continue it for 30 days after the cell infusion. The risk of cytokine release syndrome and neurological side effects varies for each person. It can also depend on the type of cells you receive. Some patients do not develop these symptoms, and if you do not, this does not mean that the CAR T cells are not working. You'll be discharged from the hospital when the care team feels you are stable and have no signs of cytokine release syndrome or neurological side effects. After you are discharged, you will need to stay close to the hospital for 30 days after the cell infusion. During this time, the care team in the CAR T-cell Fast Track Clinic will see you 2 to 3 times per week for monitoring. You may need to receive IV fluids, growth factor injections for low white blood cell count, and blood and platelet transfusions. It's common to feel tired and have no appetite for a few weeks after CAR T-cell therapy. Do your best to drink fluids and stay hydrated. If you feel well and it's safe, try to walk short distances every day to build your strength. If at any time you develop a fever, shortness of breath, dizziness, or neurological symptoms, go to MD Anderson's Acute Cancer Care Center right away. About 30 days after the CAR T-cell infusion, the care team will evaluate your response. The evaluation may include a PET scan, lab tests, a bone marrow biopsy, or other tests. You will see your MD Anderson doctor to review the results. If you're returning home after day 30 for a follow-up visit with your local cancer doctor, your MD Anderson care team will send your doctor a letter with information about your current health status and instructions on how to monitor your care and the medicines you will need to take. You'll also receive a copy of this letter on MyChart. Since CAR T cells target immune cells, both cancer and non-cancer immune cells are killed. As a result, you may be at risk for infections until your immune system recovers, and you may need regular infusions of immunoglobulin G. This helps protect you from infections. Your care team will let you know if you need to receive these infusions. You'll also need to take other medicines to help prevent infections for at least 1 year after CAR T-cell therapy. Talk with your care team if you have any questions.